We've just seen how popular liposuction is in the UK and also heard about the newer forms of less invasive liposuction, such as VASA. However, did you know that there were also so-called lunchtime fat reduction procedures and that some of the newer versions freeze the fat in a pain-free and non-invasive way? Dr. Ravi Jain is the only UK doctor to hold all 4 levels of training in VASA lipo, and his clinic also performs fat freezing. So let's see what the difference is between the 2 procedures. Okay, and here we have Chris from Brighton. Chris, hi there. You're comfortable?
I am, yes, thank you.
That's brilliant. Chris, you're going to have a Cooltech treatment done today. What made you decide for this treatment?
I think it was a couple of things really. It was only 2 years ago I ran a marathon. I go to the gym maybe 2-3 times a week and eat as well as I can, have a healthy lifestyle, and I turned 40 last year.
Oh dear.
Yes, I know, it's terrible to admit, but I really noticed the difference, and I really noticed that there are stubborn areas of fat that genuinely, no matter how hard I try, I cannot shift them.
Yeah.
I had a personal trainer for a while last year and did sessions twice a week, working on these areas, and somehow another birthday's coming round, and it's only going to get worse.
Now then, from 40 onwards, metabolism changes, and that's quite normal, and it is the same for men and women. Now, you're not exactly the biggest guy around, but you still want to address certain areas.
I do, yes. I live in Brighton as well, so obviously there's a beach lifestyle. Swimming, I would like to go in the sea, and I meet friends on the beach, and somehow, apart from getting older, you don't feel as confident, you don't feel as happy to whip your t-shirt off, and then I read about the Cooltech treatment, which it just seems like the perfect solution.
Dr. Jain, do explain to us what you're doing today.
Okay, so today we're going to perform a Cooltech treatment which involves freezing away the fatty tissue. Okay, we can lose between 20 and 40% of the fat on the treated area in a 60 to 70 minute session.
And which particular area has Chris decided
Chris
upon?
decided that he wants his central abdomen done. Okay, so this is the treatment area.
What is so specific about this treatment? We talked about VASA and lipo, but this treatment, you mentioned earlier on, you can get away with one treatment, possibly only a second one?
Yes, absolutely. I mean, for a start, this is a truly non-surgical treatment. This is a walk-in, walk-out treatment. You see, Chris is, he's just in his regular clothes, taking his top off. We're going to apply a treatment onto him, and within about 70 to 80 minutes, he'll be on his way out, back home, driving home. Whereas the VASA treatment is a surgical procedure with all that goes with that.
Wow, such a short time, and you're going to be out, walking out of here, and it'll be the new you, Chris.
Yeah, well, it sounds great, and obviously that's what's so attractive about it, that it could take an hour, and then I'll soon be back on the beach.
Okay, that's not entirely true, okay, or accurate, okay? The treatment will take an hour, but the results may take up to 2 to 3 months to see, okay? So what we've seen is that many patients are quite happy at the 6 to 7 week stage, and they come for a second treatment if they want a bigger improvement. If they're a bit patient, they can wait for 3 to 4 months for even more results, okay? It depends what a patient wants and what their expectation is. Okay?
But the quick fix lies in as much as it is one treatment that's required, not a series of
No,
6
it's
or 8.
1 to 2 treatments in reality. Some people go for a third later on in the year, but I haven't seen any more than that.
Do you think Chris will be in pain?
No, Chris will feel, first of all, he'll feel quite a lot of cold as I apply some cooling gel onto the skin first. Then he'll feel like a tight suction onto his skin, like someone's giving him a big love bite on his tummy. Effectively, that's what it's going to feel. Then his skin will go numb after about 2 minutes, and then he should be quite comfortable. After we take the treatment off, the paddle off, he will then feel a little bit of discomfort as I massage the frozen fat away.
Is it like a pulling sensation?
Yes, very much so. Then later on, in the next 2 weeks, some people, about 1 in 5 people, develop some pain which requires paracetamol or painkillers.
So that doesn't require any further, let's say, medical attention
No.
other than what you can get at your
No,
chemist and you deal with it
Absolutely,
yourself.
we wouldn't expect that.
Right, fine.
Yes.
He would not have to revisit the clinic, let's say, in order to deal with that part.
That is not the normal procedure.
Oh, okay.
Yeah. So first of all, I'm going to measure the tissue thickness on Chris's stomach with a caliper. Okay, and with the reading I have on here, I enter it into the machine. And then what I'm going to do is I'm going to apply some cooling gel. And this is a membrane which we apply to the skin, which is absolutely critical to protect the skin from freezing, because we don't want to freeze the skin. What we want to do is freeze the fat. And now we apply the cut. Okay.
How are you doing, Chris? You all right?
Yeah, it's all right actually.
Uh-huh.
It's,
Initial sensation?
it is just like having your skin tugged.
Okay. That's the pull that the doctor was
Yeah,
describing
yeah.
earlier.
So now we've got the suction paddle resting on Chris's stomach. It's actually the vacuum that's securing the paddle to the stomach, okay? And we're at the correct pressures of 2, and the timer is going down, and the temperature of the skin is now going down, and currently we're at 4 degrees, dropping down to 3, and the target temperature will be -8 degrees, and we should be there within a couple of minutes.
And is that why the white tissue is necessary? So
Absolutely, it's to protect the skin, otherwise
Yeah.
the skin will burn. So now we're at -8 degrees Celsius, which is the target temperature for the Cooltech system. This allows us to freeze the fat at the most efficient way and to get the best clinical result for Chris. Okay, so we've come to the end of the treatment. So now I'm going to release the pressure.
You still okay, Chris?
Yeah, really
All right,
good. It hasn't
okay.
hurt at all.
Wow.
Okay, so we're just releasing the vacuum. There we are. And as we can see the area.
Well, well.
As you see, this is now the area which is being sucked in. This is the whole treatment area. So this is the bit, it's not just this bit, we treated the whole area of his lower abdomen. Now this feels quite, have a feel.
No,
what's it feel
it's
like?
frozen.
Yeah, so what's
That's
it feel like?
so bizarre. It feels like a jelly.
Is
a
it
really
uncomfortable?
Ice cold jelly. No.
Is it uncomfortable? No?
This is a complete shock because I didn't even think it was working when
Okay.
it was happening.
Now I'm going to massage the frozen tissue, okay, which might be uncomfortable. And I know this might be difficult,
It kind of tickles.
and you can actually hear the cracking sounds.
That is incredible. You okay?
Yeah, it's fascinating.
What are you trying to achieve
I'm
right now with
breaking
this
down the
movement?
frozen fat.
Right.
So I'm just trying to separate the fat cells and break down the frozen fatty tissue.
Mm-hmm.
Okay, so now we finished the treatment. You've had 70 minutes of fat freezing with the Cooltech, and now all Chris has to do is we just have to give him a clean, put his trousers and top back on, and he's ready to go home.
So that was the Cooltech treatment for Chris. If you have any further questions, don't forget you can email us, tweet us, or send us a message on Facebook. Don't forget there's also the fantastic Riverbanks Clinic app, which you can download at any time.